Neighborhood Health Watch is sponsored by the doctors of HCA Virginia Health System.
Cervical cancer primarily affects women in their 40s and 50s, and ovarian and uterine cancer usually hit women in their 60s and 70s. But some of these cancers can be prevented through steps earlier in life, including a vaccine and regular gynecological checkups, including Pap smears, symptom awareness, and early detection. And Dr. Tyler Ford is a gynecologic oncologist with the Sarah Cannon Cancer Institute at Henrico Doctors Hospital. Thanks so much for being with us.
Absolutely.
Such an important topic. First, let's talk about the vaccine. A lot of parents still have concerns about this because it relates to a sexually transmitted disease, but it's so important.
Absolutely. You know, the current recommendations now for the HPV vaccine are for any boy or girl to be vaccinated from age 11 to 26. And that's CDC recommendations. And we see, what's important is that we see or have seen currently in data a significant benefit to that.
Absolutely. And then let's talk about Pap smears. How important are they in terms of detecting these problems? And also let's talk about the new recommendations that just came out.
Absolutely. So, you know, the Pap smear is a way of testing for a precancerous or a pre-invasive disease called cervical dysplasia. The importance of that is that, again, we can catch cervical cancer before it ever starts. The current recommendations are that women from 20 to 30 years old are tested every 3 years, and women from 30 to 65 are tested every 5 years. Now, those recommendations change depending on the Pap smear results. What I do want to point out is that even though those recommendations are for 3 or 5 years, that does not mean that you don't see your doctor once a year
You should
for
still
exams.
go get checked out.
Absolutely.
Yeah, okay. And especially the women, that's the only doctor they might see is their
Absolutely.
gynecologist. Well, let's talk about the signs of some of these cancers. How can women recognize it real quick?
You know, unfortunately, a lot of the signs for gynecologic cancer are very vague. For ovarian cancer, it includes abdominal bloating, abdominal pain, and pressure. Those are very vague and really can be anything. What's important for ovarian cancer is this idea that you need to be an advocate for yourself. And if you're having these kind of problems, you see a primary care doctor and you really keep going until you figure out why you're having that.
Okay, Dr. Ford, thank you so much.
Absolutely.
Really